right, good morning, bound to be good afternoon. It is 11:45, and we're going to go ahead and call this meeting to order for the Laredo West County Drug and Alcohol Commission. I want to thank everybody who made it out today. Unfortunately, we're unable to meet quorum, however, we will still conduct a business. So at this time, I'm going to ask everyone to introduce themselves. My name is Paul Rodriguez, present.
Earl Medina, present. Gerardo Montemayor, present.
Ricardo Gonzalez, Assistant Chief, Aero Police Department.
Esmeralda Rendón, ama.
Francisco Adame, scan.
Rita Camilo Scan.
Jacob Vasquez, scan.
Becky Diaz, AHEC.
Luis Serra, representative of the Laredo Health Department and Boca Chambers.
Erica Lopez, Laredo Public Health.
Catalina Romero, Substance Program Report Region. Jessica Vice.
Nancy Cadena, Webb County.
Carolina Velasquez.
Freddy Cordova, District 8.
Dr. Viviana Martinez, Roots Recovery Center. Jessica Contreras, Roots Recovery.
Adriana Morales, Laredo Public Health.
Rosa Espinosa, Verde Health.
Angela Cáceres, Border Region Tax.
Andrew Flores, Laredo Public Health.
Thank you all so much for joining us today, and as I mentioned, we don't have any quorum, but we will conduct our business with the agenda without any voting in place. Want to appreciate everybody who's out here. Make sure that we all introduced ourselves and we did roll call, but make sure that you also sign in and you grab one of the agendas and make plans to attend for the next one. I appreciate everybody RSVPing because we have food being provided by Root, so thank you so much for lunch. At this time, we're going to go ahead and continue with the invocation, and Mr. Earl will say the invocation.
Let us pray. Heavenly Father, we come before you today humbly asking for your healing touch on those struggling with mental health challenges. Comfort their troubled minds, ease their anxiety, and lift their heavy burdens they carry. Grant them strength to face each day with hope and surround them with love and support of their community. Guide their hands in medical professionals as they seek to understand and treat these illnesses. And may you grace be those who we feel alone in their struggles. We pray for a renewed sense of peace, of holiness in their hearts. In Jesus' name, amen.
Amen. Thank you for that. Just a question, do we have any public comments, Ms. Angie?
No public comments.
Thank you. Moving on, we're going to skip over the approval of minutes because we don't have quorum. We can't officially proceed with that. However, we do have Dr. Chamberlain and the administrator's report on our agenda. So what is Laredo Public Health up to?
Well, my name is Luis Serra. I'm the Parental Services Administrator for the Laredo Public Health Department. And I have been assigned to represent Laredo Public Health now on this committee. So I will be taking the place of Dr. Chamberlain. He will be here whenever he can. And also we have the backup is Erica Lopez. And so we have these updates on the statistics. The last year, 2024, we end up with 39 deaths. So that was a big difference from 2023. We have 81. So we want to think, and we're faithful that the efforts done by this committee and by the entire city help on reducing the deaths. It's almost half of what we had last year. I guess it's an effort from all, and we're happy. Yet we still have 38 deaths, so that's one is too much, right? So we need to continue doing the work what we're doing. And next one, please. This is the data map of the emergency services and the naloxone use. We continue seeing high rates in some areas of the south and downtown Laredo, and these will be updated in all of the sessions. I'm just getting used to this map. Next time I will give you more detailed analysis on this, so that we can probably have more efforts and actions focused on the areas of what we need, right? Next one. We had, as an update, three vending machines, not only one. They are located in Pascan Recreation Center, Cigarroa Community Center, and one downstairs here If you haven't seen it, you can go and see it. It's an entirely free service for the community. We don't ask anything, no questions asked. And part of the items that we put on those machines is the naloxone. And from December to now, we have distributed 59 naloxones. So those are free stuff like hygiene, but the fact that people is getting the naloxone, that it means that the people is interested on getting the naloxone. So in little more than 2 months, 59 distributions. Now to mention the other two vending machines, they were placed probably 15 days ago. No more than 15 days ago. So it's basically this one, the one we have here, that the people were getting access to now. But also we have pregnancy kits, hygiene kits. I don't know if this was discussed last time, but you can go whenever you go downstairs. It's right there. One important, very important news for the city is that we had the final approval from the council members yesterday about the bond referendum. For the people who's not very familiar with this, the bond referendum is an actual item that is gonna be placed on the ballots for May. For that bond referendum, what it is that the city is asking the constituents to allow us to get funds to fund brick and mortar for the city. Police have their items, fire, and as well as many other departments, but the health department is putting a bond for $7 million. That will be to create and build a new clinical facility right behind this building. It's gonna be, if I'm correct, it's like 60,000 square feet new facility for clinical services. What we want to do with that is having more clinical services, among others, more treatment for opioid use, for MAC, for buprenorphine, mammograms, X-ray machines. We want to have an infusion center. That we want to expand the services that we're currently providing. So now what is happening next is that on May, it's gonna be on the ballot, and the constituents will decide if they vote for yes or nay, right? Just a little information about this. Laredo, the last time they put something like this on the ballots was 1992, right? 1993.
1993.
It's 30 years. While other cities like San Antonio, Dallas, they put bond referendums every 5 years. So we haven't really increased the tax in Laredo, and this is a resource for all municipalities to get important projects going on, right? You see, you go to any other city, San Antonio, Houston, Dallas, they have many things. But part of the things are funded by these projects. And I don't know the details on specifics, but if we approve the city of Laredo public health only, it was gonna be like 0.7 cents more to your taxes. It was gonna be like no more than $10-15, the total increase on taxes in percentage. So it's not that bad. So what we cannot promote to vote for. What we can only do is just inform the public what is this for. So, and they will decide if it is suitable or not for the city. So, next one, I think that's that one. That was the last one. Also, I know the city and the city leadership went last week to Austin, and they have very important meetings. Probably Dr. Martinez is gonna tell us more about that. What I can tell you from the health department, we met with HHS, with the Department of Health and Human Services, and we requested more funding for mental health programs, and they were very open, and they said they were gonna review and take our projects into consideration for funding. And that's everything that I have to do for now. It's my first meeting.
Don't worry about it, thank you so much. We'll make an adjustment on the agenda, and I appreciate you having to give us that report. I know that I've said it before and I'll say it again, that Laredo Public Health has a wonderful team and you all bring a lot of information for us to be aware of, and of course through our agencies or stakeholders take back to our agencies to spread the word. So I think for next time, I think it would be a great opportunity for you to talk in detail about the bond, and so that
Yes.
we can continue to inform, as you said, we're not to mention or to side with one way or another, but information is knowledge, and the more that we know, the better prepared we are to make decisions that not only affect us, but the whole community. So
Absolutely.
I appreciate you having to give us that information. Is there any questions for Laredo Public Health from the commission? Okay.
I do, it seems like that, the vending machine, concept is very, popular, unfortunately, but it does save lives, we know that. Is there plans for expansions in other places? I know we have them at the recreation center. How popular is that, or how effective has that program been, and is there plans to expand beyond that?
It's, yeah, the main problem is funding. Like, I know it's very popular, it's not only the naloxone, we put condoms as example, and they run out like in 2-3 days.
Wow.
And we place them near the very young population, because on the recreation center, they all go to play basketball, and it's very, very successful. I don't think we have a problem into buying more vending machines. Not the machines are not that expensive, is the yes, yeah, that's expensive, and we're kind of trying to secure steady funding for that. And it's a good point to mention that if there's another organization that can and want share some items for the vending machine, we're more than happy to receive them. I don't know the details, Jaime is not here, but there's gotta be certain limit of weight and size. But if you have something that you can contribute to this, we're more than happy to receive them and place them. And you can put your logo. This is a community effort, right? You can put logos, so you can put whatever you want on those vending machines.
And they have stuff like feminine products, hygiene wipes, anything pretty much except that's not allowed, the fentanyl testing strips or anything like that, but anything that's pretty much like harm reduction can be included in the.
Yes, as of today, Chief, we have secured a year on supplies for these 3 vending machines. But after that, we need to continue looking for alternatives. And it will be great to expand for sure.
Thank you for that comment. As a matter of fact, for next time, would you mind, now I'm curious to know, like, with regards to how much stuff is being dispensed?
Yes.
Is it all being dispensed within the same amount, or is it sporadically where, let's say, you have 59 pregnancy tests being distributed, and then you have 10 condoms, or whatever the case is?
Yes, the team has all of those data available. I can share with you next.
Yeah, I think I would be very curious to understand that, and then with all the different agencies being represented, maybe we can contribute to something that would be considered for harm reduction.
Yes, absolutely.
Thank you. Any other questions or comments? Okay, thank you so much. We're gonna go ahead and move on to our discussion. Obviously, no action whatsoever, but it's good to have discussion, or start considering this for possible action in the next meeting. Before I get to that, I'm so sorry, I almost skipped over. First of all, I wanna say thank you to Roots for providing lunch again. And we have Dr. Viviana Martinez, who will be able to inform us what's going on over there.
So good afternoon, well, still good morning, but almost afternoon, everyone. So before I dive a little bit into the numbers for what this year looked like for us, because as you all remember, we got licensed at the end of January and opened our doors February 5th. So last week marked our 1-year anniversary of officially opening the doors, so we have numbers to share. But in touching up with what Dr. Cerda was talking about, a little bit of how the legislative session went in risk reduction, because it ties into it. So part of what HHS and DSHS, the Department of State and Human Services, shared is that unfortunately they're expecting a 30 to 40% reduction in their funding. This is coming from the federal government, right? They are looking, so we met with them on Wednesday, and they had Tuesday a budget meeting with the feds, to which they were informed, right? Your funding is not gonna increase, on the contrary, it's going to decrease. Specifically how, they haven't told them. What they do know, unfortunately, is that programs such as risk reduction and that are probably one of the first ones that are gonna go. And so it's unfortunate because as Dr. Cerda was saying, right, we're wanting to secure funding. These strategies do work when you implement them properly, but unfortunately to our federal leadership, specific to like direct care is what they'll be focused on, and then certain areas of direct care. So unfortunately, let's hope it doesn't go through, but something that they're looking into is that things like risk reduction, and that is not where they want to invest their money. So that's sad news to share. But in keeping with risk reduction, Roots Recovery Center is a 24/7 Narcan distribution site, so we do have a Narcan cabinet there. Because we're open 24/7, individuals do have access to it, no questions asked, to the cabinet. So we do have that there. And part of also the discussions with HHS and DSHS is, for those of you that are in the field, you know that an RFA was put out for the next 5-year funding, what's in our field. So we did, Roots did submit their proposal for funding with them. So hopefully in the next few months we'll be, we'll get word. I did meet with Commissioner Young, and so she did specify, right, that being that gap that we do have here, that we don't have a detoxification center, right, other than us. That they feel confident that the funding for our center will go through because of, meeting that gap. So just so you guys know, we did submit that for detoxification services with the state. So going into what the center has done, or what it has looked like over the course of this past year. So we had 452 referrals. Now when I say referrals, these are contacts that we got a referral from an agency or individuals that called, and we were able to have information on them so that then we can reach out. We have many more on that list, but these didn't materialize. Either individuals said, no, this is not something we're interested, or somebody, a family member or an agency called just saying, I have a client, but we have to be able to speak with that individual and collect information. So if we don't have a way to contact them or reach them, then we haven't jotted down, for example, Scan referred Jessica Contreras, but we weren't able to make that true connection. So internally, we're not counting it as a true referral, because I really can't do much with it. So we've had many more, probably close to 1,000. But the ones that we can say, these are individuals we have followed up with, and have information to continue doing follow-ups to get them in. We're 452. Out of those, we were able to admit 287 individuals. 91 of those individuals have a dual diagnosis. Now, we know that many more have mental health, but the ones that we say they have a diagnosis, that we can prove. So either they were diagnosed through our psychiatric nurse practitioner in-house, or they already came with a diagnosis. So a little over a third of our patients have a confirmed severe mental health. So as you guys know, we do medical detox, but we also do crisis stabilization, where if they have a substance use disorder, then we can have them there for 72 hours for crisis stabilization. Over the course of this last month, we saw more than we did in the previous months, but that's because it's a common trend to come the holidays it really hits them really hard. And so we have people with depression, with a lot of anxiety, and then, and our goal is that bring them in to ensure that they don't relapse or that they don't use more, and it's at a higher dose that's gonna put them at a risk for an overdose. And for you guys to get an idea of the diagnosis with C, opiate and stimulant, which is for the most part for us cocaine, are the two highest substances that they come in using. They typically are using both, right? They use heroin or painkillers or fentanyl to sort of bring down, but then they need the cocaine to go up. And then alcohol and sedative, we had 42 individuals that have a alcohol diagnosis and 23 with a sedative diagnosis. We don't see very many, but all of those numbers are lower. They're the most difficult to treat. Okay? Alcohol being the most difficult to treat, which many people don't know. People can die from alcohol withdrawal. And we have already seen in our center, I think we have had 5 of our patients have seizures while they were in the center due to the alcohol or the Xanax sedative withdrawal. So they are very difficult to treat. Please educate your population that with alcohol and sedatives, it is not recommended that they try and withdraw at home. It is very dangerous. It needs to be done under medical supervision. With the other ones, they're going to have really nasty symptoms, but they're not at risk for seizures. And like I said, we've already had 5 individuals that actively seized on us while there, and then we got them to the hospital. They were all able to come back and continue their services. So our ages have been 18 to 75 years of age, with the median age being about late 30s, early 40s. And we had 238 males and 49 females. We currently do not see pregnant females. This is part of what we proposed to the state of having the additional funding, because in treating pregnant females, there's a lot more resources that we need. We don't only treat the individual, the adult, but we have to take care and monitor the fetus. So there's many more complications that come with that. We're hoping that with this state funding, we'll be able to make those accommodations to be able to now accept our pregnant females, meaning that we've already went a year through it. Our staff, our medical director have seen what this population looks like and what is needed to treat them. So now we can expand to our pregnant females. Because at this point, this is what the gap, at least for the adults that we treat, we have. I know there's still many more strides to do to bring these services for adolescents, but we're not there yet, and expand on residential, we're not there yet. Part of the proposal that was also done to legislative was more funding so that we can expand our substance abuse services or dual diagnosis in our region. We do need a larger facility. We need more facilities so we can have more beds, we can have more residential beds, and we can also treat our youth. Because we know that we have youth that need detoxification services as well. So those were conversations that we had with them, writers that we provided, and data to show them the need that we have in Laredo. And lastly, to go with what Dr. Zeta said about the reduction in overdose, that translated to a 53% reduction from 2023 to 2024. It is the first time since 2017 that there was a reduction. From 2017, we started seeing those numbers pretty much double each year. And then 2024 has marked the first time in those time frame that it went down, and it went down by 53%. So what we're doing as a community is working, right? Everybody's doing their part, these different risk reductions, what fire does for PD, what your agencies does along with the detoxification center is showing promise for our community.
That's wonderful news to hear. congratulations, because it's been a year of learning and going through stuff, and now apparently, funding is reduced. We'd like to hear that the reduction is there, but not the reduction in funding is never nice to hear. And since you mentioned right now about that you're not able to serve the pregnant population, have you gotten numbers with women?
We have had 6.
6.
None of the 6 knew they were pregnant. So because our protocol is to do a pregnancy test, we do a urine analysis, and then we send them to the health department for confirmation, and all 6 have come back, that it's confirmed that they were pregnant. So everything, we did everything we needed to know at the point of starting. What we do with the females is we also ask them to come for a UA when we're starting the paperwork. So at the point of starting all the pre-screening, they were not pregnant. Within whatever time it took to get them ready, and then also some get lost, and then, we're following up with them. We find them, they come in, and then they're like, no, but I can't be pregnant. And we're like, well, and so based on what they tell us, it's like literally just happened, because they're like, no, I got my period 3 weeks ago, so I can't be pregnant. And then we send them over, and sure enough, they're pregnant. So we have had 6 females that are pregnant. And again, all of them found out through getting their test with us. They weren't aware.
I was gonna say the other difficult or challenge part with the pregnancy is that the treatment for opioids specifically is different.
Yeah, and that's what it's different resources. It takes a lot more to treat them. It's not the same protocol that we would follow with anybody else. So it's very complex. So it's not just that we don't want to treat them. It just takes a very different treatment plan for them, so that we can detox them safely. And then if they're doing sedatives, so everything, sedatives, whatever it is they're taking, the protocol is going to be different for our pregnant females. It breaks our heart when this happens, and then we found out they're pregnant, and we're like, shoot, right? And I do want you all to know, we are working to try and figure out how we can expedite the process for them, but unfortunately, that 3-day wait for TB, and literally it's like, okay, and it's like, you weren't pregnant a week ago, now you're pregnant. Because we do want to try and get them in as soon as possible, and I know that it's always been thrown out there, well, why can't you do walk-ins? Part of also the conversation with HHS is Nuevo Laredo does have an issue, right? As a border community, they do have issues with TB. And us being a border community puts us at a higher risk. If I remember correctly, I think Dr. Chamberlain shared that there was like 16 confirmed TB cases right in Nuevo Laredo just this past month. So being that all that commute that comes and goes puts us at risk. So unlike communities that are further into the country and the state, they don't have the same high risk that we do. So that is why for our facility, the TB test is a must. We can't afford to put other people at risk. And like I said, just from what Dr. Timberlake reported, that was the report they got from Nuevo Laredo just from the previous month, 16 confirmed TB cases. So that's what we do.
Thank you so much for the information. Is there anyone that would like to make any comments or
I have a couple of questions.
questions?
How many readmissions of those that we admitted this year?
We have about a 28% readmission rate.
30%?
Mhm.
Okay. And third admissions? People
Third-
that have been there 3 times?
Well, then that reduces. We have had, with the last numbers I ran last month, we have about 5 individuals that have been there more than, that'll be on their 5th time. And then that it's 2 admissions, then not counting those. We had 8 and 3 admissions, when I ran it was 12.
And how many admissions out of Laredo? That weren't from Laredo,
We probably only have 3. They were from Zapata.
from Zapata?
Yeah.
What county, that's what county, right?
No, they're Zapata County, but they're sort of. close enough. So we only had 3, and all 3 were from Zapata.
And do we have funding for this year?
For this year, the
Not
city's,
waiting on.
no, the city's carrying us over.
For the year, so we're
So
good
the
for the
city
year?
has committed to carry us over for 3 years
Got it,
to allow county funding to come in.
good.
So, and I wanna throw out there really quick, because there's always this sort of feel of attack towards the detox and what we do, because I'm pretty sure it's gonna come out very soon. We unfortunately had to, this is the second time we have this issue with our local AA meeting, or sponsors or whatever they're called, group. So a couple months ago, we had asked them that, we had advised them that our patients did not feel comfortable with the way they talk to them and they treat them. And that they didn't wanna go to their meetings. And so we spoke to, Richard K, I forget his last name, Mr. Richard K. Kowalski, something like that. We addressed it. We let him know that, based on the feedback that the patients were telling us, it was important that the approach of how they talk to them, what they talk to them about, change, right? Because, it's stuff that calling them, and I wanna be blunt, right? Pendejos y drogaditos y lowlifes and then talking about, there's a way, I'm a counselor, there's a way to talk to people about their use and that doesn't trigger them and doesn't offend them and doesn't belittle them. So that was brought up to them. We asked them to please figure that out, and when they were ready to move forward, they were invited back to the facility. So they came back this weekend, and the exact same thing happened. So this morning, we reached out to them again. So Mr. Richard was very, very upset, obviously wanting to know who he could report us to and whatnot. All the information was given to him as to where he can go. And he was very upset, right, and saying, well, your program doesn't work and you're not doing anything for the community. And how dare you not accept our help when you don't even have resources? But again, we're not there to make these patients feel bad about the life choices they've had. We're there to make them feel safe and take the next step in their recovery. I'm sharing this because this is a organization that many of us work with, and this individual already voiced out que los voy a poner en mal con todos, and it is what it is. So, because it's, but all this has been reported to our upper management, but first and foremost, the well-being of our patients and our staff comes first. And when our patients are being abused, neglected, or exploited, I will have to make a decision like that. So at this moment, we're dealing with that, and again, we tell them whenever you guys can address whatever it is that needs to be addressed, you're welcome back, because it comes down to the patients don't want them there. They're not gonna participate with them, and they said, no, don't ask us to be in the room with these individuals because this is how they're treating us. So I wanted to share that.
Okay, good. I think support groups are supposed to be there to share their experience, strength, and hope. What it was like, they were probably sitting in detox themselves.
And I understand that, yes, but again, right, there's the way, but there's other support groups that go, and we don't have that issue with the other support groups. That's not the only support group that goes, we have several. SCAN also sends people, there's other faith-based, so there's other organizations that are going. It has been with this specific, just one, and with these, that issue has been happening, and we do need to protect our population.
I wasn't aware of it, so the process of them entering the detox center is that they're doing a service to
What is it that they're
clients.
taking in there? A meeting, or what is it?
Their meeting, it's their
They're
meeting.
running it like a meeting?
It's their meeting. Well, we don't go, because we don't go to the meetings, right? They do their peer support group meeting with the patients.
Okay, so nobody from the center is inside the meeting with them?
No, because when they do
Okay, so-
AA meetings, non-participants don't go in there.
Okay.
But the patients, and it's been a pattern, it's only when those meetings are going on with, that. And it's not one patient, it's as a collective group, they have voice, not feeling comfortable specifically with how those meetings, basically they're saying, this is not helping us. This is making it worse, and not only that, but, they're talking down to us in the language they use towards us.
But you understand with the population you're dealing with,
I
they're very
do.
manipulating, and
I know.
was it on a Saturday when they took the meeting there?
Oh, they have gone on weekends and weekdays.
Okay,
It
but this
doesn't-
last one was on a Saturday?
This last one was on a Saturday.
Okay, so maybe they'd rather just been in bed.
No,
Then
but,
it can
we
be-
have very specific rules and our patients are not in bed all day.
Good.
They're not, so, there's a very specific schedule, very specific protocol. I constantly talk to the patients. I am not new in this field. I know how this population is manipulative, and that I understand, and we always point, we'll address those things. But this is not one patient. This has been in the past with a whole other different group. With this specific, support group individuals, the exact same comments and concerns came up. So it's not the first time, that is we can justify that it has been in different occasions with different groups, different days, but the exact same, support group that came up.
Dr. Martinez, and correct me if I'm wrong, double A groups are not necessarily for the detoxification process. It's more like for the sustainment, right?
Yeah,
Yes.
but they go in to start providing, getting them acquainted with the services and hopefully in hopes that, upon leaving, they've already connected with somebody, had a sponsor. Even like when Border goes, we introduce them to those services because they need to be linked up at that time. Otherwise, they come out and there's no support system and they feel like, well, you haven't linked me up with anybody. So that's why they go in there.
Yes, so then getting into a type of peer support and, different styles or very harsh styles is never gonna help during the detox process. I understand the point of, yes, I'm here when you go out, you can join, and there's many other groups.
And that's a different goal. And that's true because remember, a lot of them, that is the very first step towards recovery. And I understand what you're saying, right? These are individuals that were in that same position years ago. But, no, just do a very quick, simple example. I was a teen parent. I became a parent at 16 years old. So me going to a school and telling the kid, well, because I got pregnant at 16 and now I have 2 doctorates, you have to do it too. Porque no seas pendeja, no seas esto, no. That's not how it goes. There's ways, even if you're doing support, there's ways to doing it. And I understand that as counselors, we have formal training compared to somebody who's a peer support. But there still has to be this line of respect and understanding of what they're going through, because we have individuals that are literally, today was the first day I haven't used. And hearing that I haven't done anything with my life is not helpful right now, right? I'm not gonna tell other people how to do their job or how to run, but when I'm hearing collectively from the people I'm needing to serve and protect, that this is hurting them more than helping them, then I have to step in.
Well, thank you for informing us on that. Is there any other discussion or comments regarding the information that was just shared by Dr. Martinez?
I just have,
I do wanna clarify that it is voluntary for them to get those services, so I know from first-hand experience and the plans that I've referred, they don't have to go to the AA group, but obviously we wanna protect the client and make sure that, they're safe and they're receiving appropriate treatment, so, thank you for all you do, and thank you for having us.
Doctor, who's taking the lead in cutting in services for our youth rehab center? Is that you, is it Stan, or, you
Well,
mentioned that there's a push.
Well, I mean, in that, in the sense of representing our community, I pushed in those riders with the backup of Dr. Chamberlain and our city management. That I recall, I didn't see any other organization in Austin, but in terms of what we went to go do with our legislative, we pushed it as a community, yes.
And I do want to commend Dr. Martinez and the Roots Recovery Center for also administrating and making sure that their mental health is very well taken care of. We've always said it comes hand in hand. And unfortunately, they can have all the support and all the medical team offering them the detoxification, but if their mental health is not there by that constant push down, then
The chronic cases.
Yeah.
Okay, I wanna say something, okay? I do work right now like a peer specialist recovery and AMA. I used to work with Bethany House as an outreach. I have a lot of experience working out on the street, and now I'm getting the experience working. I do have a beer experience. I used to consume alcohol and tobacco. My testimony is that Jesus set me free. So I know to work with both population, either based on faith or scientific method. However, the peer is his case. I do groups with AMA, with the ones in opiates or fentanyl, group sessions in the mornings from 9 to 10:30, and I also do single sessions. And believe me, this program, when I invite Ms. Arcee to this, to join the Bethany House agency outreach, for me it was like a door for other people, because there's, you're gonna work with a client, depends on their needs. Each client is different, and each client, you move them different, depend on their case and their needs and their past and roots they have to deal with, everything. So I'm there. Any kind of assistance that you all need, contact Mr. Lozano. I'm willing to help you on that facility with a prayer, with my knowledge, with whatever it has to be, so we can move these people around and make them aware that their recovery is possible, because it is.
Jessica just wrote down your information.
Yeah.
Thank you.
Thank you, Senadora. And thank you everybody for your comments and the discussion. I think it's very important to review those MOUs and obviously be listening to the clientele that is there. And thank you again for informing us on that information, because we have multiple agencies and stakeholders that can possibly contribute into the detox center. So I appreciate you all having to provide that information. If there aren't any other questions or any comments, we're going to go ahead and continue with just an overview of what we have been able to discuss the possible action. But because we don't have quorum, we're just going to go ahead and go over it. We wanted to review upcoming awareness campaigns and social events and planning. Obviously, everything that Laredo Public Health and through the Drug and Alcohol Commission, it has been working. We're glad to hear that there is a 53% reduction. So start thinking of more awareness campaigns, social events to possibly consider and to do collectively through the Drug and Alcohol Commission. Additionally, we have some members that have been attending and have not been attending, so we wanted to review the attendance participation, the status of the appointed and the vacant drug and alcohol members, because we may or may not know if Ms. Carolina will be here next time around. Do you want to advise us of your status?
Yes, so as of right now, I am transitioning to leaving out of town, so I spoke to somebody that have kind of routed me to this committee, and they forward that to Melissa Cigarroa, so they are looking for a replacement, and we're thinking about somebody in the juvenile drug court. Her name is Alexandra, so in the next couple of months, that will be the transition through the city of Laredo. But I did wanted to come here and talk to Angie first and Colleen, that it's been a pleasure to serving in this committee, and anywhere I am in the Texas, I'll be a phone call away, any resources that you might need. But yes, I want to thank all of you for this opportunity, and Colleen especially, and Angie for being a great. But yes, it will transition within the next months. I don't know how long it'll take for the city council to reach out my replacement, but last time when I came in, it did take about maybe 2 or 3 months. So, but yes, I'll make sure to say my goodbyes before it's my last meeting.
Thank you so much, and we're sorry to hear that you're leaving, but obviously a congratulations is in order, because she is working on her education, and education is extremely important because you become a bigger asset to our community. So we hope that you go and come back and you contribute wherever you're at, and so appreciate you having to be with us today. And so that's what we're gonna discuss at the next meeting, the attendance participation, again, the status of the appointed individuals. We want everyone to be here and to obviously make quorum so that we can make the changes that are necessary for our community. But we appreciate the impact that you have made through your resources, and thank everybody here for having to come in on a regular basis to contribute to the meetings. Thank you very much. We also had a status update on the City of Laredo committee training. There was a committee training earlier in the latter part of January. And and we wanted to review the attendance and the training requirements. And so just briefly, we have a lot of very familiar faces, but we only had 2 familiar faces at the meeting. We completely missed it, I say we because I'm including myself, but Earl was in attendance. Miss Angie, or Earl, would you like to share what the committee training consisted of?
Well, they explained a little bit more in detail what, being part of an agency or committee, attendance was one of the main things that they talked. The city manager was the one talking about, how important it is to attend these meetings, how, effortless it is to be a source and represent who you're representing. But most importantly, they, talked a lot about their bylaws, what they're discussing. And of course, I believe the assistant city attorney was there and was discussing about legal actions of stuff that we could speak and cannot speak in the meeting. But one of the main focuses that they did bring up was attendance. Was one thing that if you're part of representing a council member or any organization, attendance is mandatory to those that are sitting in chairs. So that was one thing that they did speak. Did I miss anything, Nancy?
Attendance is the start, basic information when we have quorum, when we can start meetings, if we don't have a quorum after 20 minutes. Just very detailed, so maybe they can share those PowerPoint presentations that were presented, because it did have a lot of information.
Yes.
So is there a requirement that we have to, because I know that Ms. Angie did share the video, it's on YouTube, so she'll share it with everybody. Everything that was said at that time too, those in attendance is in that video. But is there a certificate or something that you all gained from it, or was there something that's required? Just, it's a recommendation that everybody make sure that you all review it, and so Angie will send it out and we'll talk about it and we'll note on it, because moving forward, there's a lot of factors. For example, a prime example is quorum. So if we don't have attendance, quorum is not met and we're not able to proceed. Now, we value the time that everybody has made it out here, so we are conducting the information, but we're not able to move on business because of the fact that we don't have quorum. So again, can't stress that RSVP, because there is food involved and there is a cost that is included in there. So again, time and money is being invested with having to be part of the Drug and Alcohol Commission at any point in time that you're not able to continue, as Catalina isn't able to. We completely understand. We just want to be able to move somebody in there that is able to make action, take action, and bring those resources to help our community.
Colleen, maybe we should do a reevaluation or get a poll again for meeting times. I know at one time we were meeting after 5:30 and it was not very convenient for a lot of people at that time, so we moved it to the lunch hour. But maybe there's a better time, maybe, not the lunch hour, I'm not sure. So maybe we can look into that, to see if everybody has a better meeting time.
When was the last time that we did the poll?
Oh, it must have been like 3-4 years ago.
We did the what?
2 years ago.
Oh, yeah.
It's when we transitioned from the afternoon meetings to the lunch meetings. This time goes by so fast that it just seems like such a long
I think it's about time.
Alright, so then we are in the process of submitting the biannual report, and so the attendance has indicated that obviously a lot of people have not been showing up. So moving forward, we will take a poll into consideration. I ask that everybody, including our stakeholders, complete that poll so that we can have a better understanding as to what time is better. I know that there's some meetings at 11:30, there's some meetings at 12, some meetings that happen early in the morning. So it just depends, but obviously we wanna be able to have the majority here because there's a lot of information that is being shared and that can be taken back to our agency, so thank you.
And initially, I think the meeting was supposed to be an hour long, but we started 30 minutes before to get a head start on the lunch. But if we're gonna choose a different time, then maybe we can go back to the 1 hour lunch, the 1 hour meeting.
Okay, for sure, thank you so much. Ms. Angie, anything else that you'd like to include or share?
No, that was about it.
Okay, thank you so much. With that said, we're gonna move very quickly, ensuring that you all have the time to go back to your offices. We do have a presentation from Ms. Becky Diaz from APEC. Would you like to share your presentation, please?
Yes, so
I opted on not putting it out there, and because of everybody's time, I'm kinda gonna speed through it, and then we're gonna be going over the booklet a little bit. Just so everybody knows, Area Health, my name is Becky Diaz, I'm the Special Project Coordinator at AHEC. AHEC stands for Area Health Education Center. What we do is we go through 3 different components for the community. We help our students look forward to college and looking forward to a career, so I'll talk about that in a moment. Our community, we like to keep them informed about different programs, and in terms of professionals, we like to link people to CEUs and continuing education credits to renew their licenses. We serve 7 other counties besides Webb County, Dimmitt, Duval, Jim Hogg, LaSalle, Star, Willacy, and Zapata, and we have various projects going on with them at any given time. And so we'll just go ahead and go through the booklet for time's sake. We have a food distribution coming up. It is open to the community. A lot of people ask me, where is this? It's 359. We're trying to enter the colonias, but really anyone is welcome. Due to everything that's going on right now, we are emphasizing that there is not like an ID required kind of thing. We ask that people go through the health resources. If any of your agencies are interested in signing up, we do have free booth exhibit space for people to sign up their agencies. The flyers in there, English or Spanish. If you guys have any questions, go ahead and reach out. For any of these, if you have any questions, just reach out to us. So we have our Student Leadership Club, which is how we help our youth in our community. It's for grades 7 through 12. We'll go out to the community, do different projects. This next event that's coming up is this Saturday, is Volunteers Serving the Need. We go and help the Veterans Thrift Store, and we're going to be helping with their food distribution. Then we have our monthly meetings now for our mental health virtual seminars. Those are free to the community. Anybody can join, professionals, non-professionals, just sign up with the QR code. We have different topics, different speakers. They come from all over the place. This next one will be stress in the gut. So it is helpful information for everybody. We have 2 programs coming up for our students, and this one they are not required to be part of our leadership club to join. It's called Draw the Line, Respect the Line. It is to teach 6th, 7th, and 8th graders how to better communicate. These are classes that we will be having at the AHEC office. Each grade level is separated on different days, and you can just go ahead and sign up with the QR code. Once we have a group, we will assign the date, so it is still open. The same with the 17 days workshop. That one is geared for girls ages 15 through 19. It's the same thing. They can register, and we will let them know what days are available, and we'll go ahead and work with them on that. That one is also to help them learn how to say no and how to stand up for themselves, which is all very important. As you see, a lot of our programs correlate with the drugs and alcohol like prevention stuff, because it is just keeping them informed and getting their foot in and like getting them used to saying no to things and just learning overall. We also have our Platicas, which is the cancer series that we have with UT San Antonio. The Maine Cancer Center sends a representative to come and give these presentations. This next one will be over colon cancer. It is free. You do not need to RSVP. You just go ahead and show up. It's open to anyone, so again, any of your clients are more than welcome to join us. The flyers in there in English and Spanish. We're also looking for breast cancer survivors to help in a research study. This is partnering again with UT Health San Antonio. Just go ahead and contact us if you want to sign up anybody or if anybody wants to sign up. It's going to be a well-rounded program. It's a 26-week thing, but it's all free, and there will be, I know there are different rewards to that program. Again, that's the Student Leadership Club QR code. That's how the students sign up with us. We promote 988 as you all are aware, and in the back you'll find the crisis lines. The black ones are the national lines, and the blue purple ones are our local ones. So if anybody sees that their agency is lacking here, go ahead and contact me, and I'll go ahead and update it and add you guys on there. So again, if any questions, go ahead and let us know.
Thank you so much, Becky, for all the information that you just provided. And I'm sorry that not everyone was here in attendance, because AHEC has been doing a lot of really neat stuff and getting the community involved. So there's, the epitome of education. So there's a lot of stuff that you all are able to provide. So for the stakeholders and the agencies, take advantage of AHEC. And
we also go around giving mental health presentations and things like that, engaging for the kids, and for adults we do presentations like court and things like that. So it is a lot that our agency provides.
Thank you so much. I know, any questions for AHEC before we move on? Yes.
Ms. Starkey, is this your phone number on here?
That is the office and phone number, so you can ask me, yes.
Okay.
Are any of these you can see them online or you have to be in person?
So depends on the program. So like the mental health virtual seminar, for example, that's through Zoom. So the person will register and they will get to hear it or see it wherever they are, which is actually really important because a lot of these resources people don't want to go and listen to these things.
And then the kids ones were the
kids ones are in person because they are trainings for them. So the 17 days one is a self-paced one, so they will get to do it on their own and they'll be interacting with the trained staff to be able to go through the program. And then the other one will be done more in a group setting for Draw the Line, Respect the Line.
Any other question or discussion? At this time, I'd like to formally welcome Assistant Chief Gonzalez. I know that Earl reached out regarding participation in the liaison for the Laredo Police Department, and so I know you brought some really good information. We hope to see you not just today, but for the upcoming meetings, because I think one of the things is that we get to contribute and also get some information that the Laredo Police Department has, and I see from the slide that you have information, so the floor is yours.
Yes, thank you. First of all, I apologize. I know there's been some change in our leadership the last year or so, and Chief Maciel was very involved with his committee, retired, and we weren't, we kind of dropped the ball on not assigning somebody to this committee, but thank you, Earl, for reaching out. We're here today, and I'll be brief. I know you've been overwhelmed with information, but because we haven't been here in a while, I want to show you some numbers of what we've been seeing, trends that we've been seeing. These are the last 3 years of information regarding overdose deaths, like Dr. Serna talked about earlier. And these numbers might differ, the health department's numbers, because these are just Laredo, City of Laredo investigations versus more of a county information for the health department. But you will see the trends in the first bar graph that the last 3 years, they have been declining from 2022 when we saw 41, 2023 was the highest in 66, and 2024 we were able to reduce it with all the harm reduction strategies that this group and the whole community has been involved with to 36, but we can't rest on our laurels. We need to continue, not only continue with the programs that we have in place, but new ones, and I'll talk about a big one that's coming up for us. As you can see, the correlation with when we increase the number of arrests, we tend to reduce numbers. You see it in the overdose deaths and the drug arrests. On that pie chart, you'll see the drugs we recover out there. So marijuana is a big one, cocaine is a big one, and we're seeing a lot of vape pens as well, those numbers increasing. Now there's I think it's the yellow sliver that you see under on top of heroin. That's fentanyl. Even though it's very small, these are suspected drugs when we recover. Everything goes to a lab, we get confirmation thereafter. But I'll tell you, I think over 90% of our death have a link, overdose deaths have a link with fentanyl. Even though the suspected drug at the time of usage is cocaine, even we seen one case of marijuana with a teenager, it was laced with fentanyl. So that tells you how dangerous it is and how a lot of these deaths are as a result of unassuming users. We continue with the EWI arrest and the intoxication assaults. You'll see the same thing. We've increased our enforcement on EWI arrest from 2022 from 446 to last year 622, and the intoxication assaults have reduced significantly. So we'll continue to do the enforcement as much as we can with these campaigns to be able to reduce the number of deaths related to drug and alcohol. But obviously we can't do it alone. A lot of your programs help significantly, and obviously prevention here is a key, or rehabilitation. We go on to the second page. No, not that other one. Those are numbers for this year. This is a highlight of 2024, which you saw in the charts. The next page will be 2025. Our numbers so far year to date. And we've had 2 deaths, 1 male, and one female. We've only had one intoxicated assault case so far, and our arrests so far this year are 60. If we continue, this is the 2024 heat map for overdose deaths. So this is the 2024 heat map. There's a high concentration in Central Laredo, but obviously, all the community is at risk. These cases over the case. The city in 2025, which is the last slide, again, concentration in Central Laredo. So that's where we're concentrating a lot of our enforcement. We see the spikes in South Laredo. Yeah.
And Central Laredo would be considered where we're at right now.
Yes, ma'am. So, talking about new harm reduction strategies, we know that Narcan is very effective. It's helped save a lot of lives. So we're launching a new campaign, what we call the drone as a first responder. So we're going to have pods throughout the city, strategically placed to respond to emergency calls, what we call high priority calls. These are the eyes in the sky or at the scene of a major crime or crime in progress to be able to either do de-escalation or have more information to respond better, get a bit better at what we do. The first drone is going to be housed here, just on the other side of the building. We hope to launch it within the next 2 to 4 weeks. Yeah, so it'll respond Central Laredo. One of the main features of this drone is, so it's going to be, as the pilot is hearing the call coming in, so it's going to be a combination of a dispatcher and an officer pretty much, because they'll be able to hear the calls coming in even before the dispatcher packages it up, finds an officer that's free, dispatches, the officer acknowledging and then responding in a vehicle. So the drone operator will be able to hear the call even before it gets created. It's already launching the drone in the air, and obviously without having to follow traffic laws and avoid traffic, it'll be there in seconds. So we'll be able to get better information on what's happening. One of the things that we're going to utilize the drone for is to deploy Narcan. So we have an overdose case. This equipment is going to be able to deploy and drop Narcan at the scene if they don't have it. Be able to, the drone pilot they're already training on be able to deal or communicate with the any person there at the scene to help them deploy or administer the Narcan. It'll have two-way communication, yes. So we hope that it's able to mitigate a lot of the death numbers that we're seeing, but we'll continue to do more as technology allows us, and obviously personnel and equipment that comes in technology.
You said it's gonna be housed here?
I'm sorry?
It's gonna be housed here at the
Yes, sir.
I thought it was gonna be at the fire department.
No, so we're gonna start with 4. One's gonna be here, the other one's gonna be at the fire department that's in the North Laredo. There's gonna be another one at the annex building, the annex building by the loop. There's a 4th site that more than likely will go at the new Cigarroa Middle School building.
Okay.
And then there's gonna be at the far end of the city, that's gonna be housed at Eden Recreation Center. The 6th one's still up in the air because we need to service the Mines Road out of that area. We don't have a lot of buildings out there, the city of Laredo. So we're currently working with a private partner, UPS. UPS is a great location. It's perfect for what we need to do. We're constantly talking to their headquarters to be able to house it there. So we're gonna reach out to, we're working with LISD to place the unit out there. It's gonna be temporary because we're building a substation just across the Cuatro Vientos Road. So it'll go up once our building goes up. So a lot of things that we're flexible, we'll move as we need. We'll duplicate resources as we need. So that's the plan. This is gonna happen within the next few months, but the first one will be housed here at the health department. So thank you, health department, for the support.
With regards to the high priority, other than potential overdose situations, what would be considered a high priority that the drug would be?
So it could be anything so all our calls are as they come in, they're categorized. So whenever there's an armed subject, an assault in progress, even an accident with injuries, we can deploy the drone and get the fire department information as far as the severity of injuries. That way they can respond, adequate personnel and equipment. So those are just some examples that we'll be able to use the drone for.
How about the mental crisis? I know in the plazas, there's people that they go that crisis are screaming, they're hitting people or whatever.
Right, so it only depends how the call comes in and gets prioritized. Because somebody that's there's nobody around, of course, is not gonna have the same priority as if the person is possibly armed, is threatening people, of course. And as things change, they change priority, but they have to meet that criteria. Because we just don't wanna be launching for just the mere fact that it could escalate, because something else we might need it for a call that we know for sure it's a priority one. And these drones have technical, their capabilities are limited, right? So they have up to a 45-minute flight battery, but that varies with weather, winds, how fast we're flying in, how much is stationary, how much is using the communication on it, because all that's feeding off the same battery. When it comes back, it actually charges while it's sitting on the pod, but that takes a little bit to pod. So we have to be very responsible how we manage these assets, because they're gonna be limited. So we have to prioritize. And of course, we're one of the first ones in the country, so we're kind of a leader in this aggressive. So we'll be adapting the program depending on the need. And of course, if we can grow it even better. So we have to be very careful with privacy of citizens. That's gonna be a huge one for us. So we're gonna launch it where we're not gonna be invading people's privacies and so forth. So public areas, that's a given, but when we respond to homes, we have to make sure that it's something that this tool is gonna be able to support that response.
Is it kind of like an emergency vehicle?
Yes, it is. Well, it has lights and sirens, by the way. Yes, it does.
Lights.
It's got a lot of features to it. Obviously, it's got the two-way communication. It's got the heat. Infrared camera. So a lot of features. But yeah, so we have to be reflective how we deploy it, because if there's something happening inside a home, this drone is not going to be able to fly inside. We have another drone for that.
Yeah.
But yeah, once if it's kind of a barricaded subject situation, so forth. So we're designing the program as we speak, as a need arises that balance the act. And it's fairly new, so we're, like I said, we're the leaders. We're pretty much setting the pace for others to follow.
So I was just about to ask about the population that's using this, so it's the first.
Right, so there's several programs. Santa Clara was one of the first ones. Pearland here in Texas, we personally visit those sites because we're trying to learn from them, and they're very limited. They respond to very few calls. There's very little infrastructure, limited infrastructure. They have somebody up on the roof launching these things. They can afford it because they have the weather to do it, especially in California. We can't. It'll be 120 up on the roof. These things have HVAC systems, so they'll be able to cool the drone while it's there, and then they'll fly. But ours are gonna be autonomous. They're gonna be, the software behind the drone, because drones are very popular, right? A lot of people have drones. What makes it very advanced is the software that is able to launch. You can have the pilot fly 2-3 drones at the same time, because they work out from GPS. They can enter an address. These things will fly autonomously, and they'll take over when it's there. They can fly another one, and the drone will just hover, and they'll just focus on specific information to feed up the officers. Once they get what they need, they can come back. Or officers at the scene, if it's no longer needed, they'll come back. So we can do multiple flights at the same time.
Very cool, thank you so much for that information. I think we're excited to see how responsive the community is to it and how effective it is, considering the response time. And so with that, what's the average response time to a call?
So it all depends, if it's here, it takes about 50 minutes to 50 seconds to activate, open up the launch pad or the pod up in the air, and depending where it's going, if it's going somewhere by Jefferson and Santa Ursula, it's probably about another 15-second flight path.
And with regards to an actual police officer being dispatched, what's the policy behind
So we
Together.
prioritize, right,
Yeah.
depending on sometimes, and we have peak times. So what we do is we average, right, cause 6 in the morning, call comes in, you'll have several officers at scene very quickly versus 5:30 in the afternoon when we have a lot of accidents and calls sit. So we factor everything, I think right now we're at 7.5 minutes, close to 8 on non-emergency, non-priority calls. On a priority one call, I think we're hitting 4 minutes, 3.5 minutes, which we're on the national standard, but to me or to us,
it's still not good
it's not enough, we can get better. So this, we can factor of being at scene without having a physical body there and already contributing to addressing the call.
Got it. Okay, well, good information, I think that's a good way to, understand how quickly the drone will respond as opposed to an actual officer.
When will they
being out
launch
there.
this?
So we already have the infrastructure in place, we're training our pilots, who should finish their training in the next 2 weeks. The equipment is about to get packaged and sent to us from Seattle. So we're talking anywhere 2 to 4 weeks, we're obviously one of the first ones in the nation, right? So I think the other ones we're kind of competing with is Las Vegas, Metro, New York City, and there's another one. They're also very aggressive, but they're limited because of the high rises, and we're perfect because we're flat. We don't have a lot of high rises. We're able to get licensing from the FAA to be able to launch these things without having visual on them. We're using a lot of technology and obviously the safety components of the drone to be able to fly them without from somebody anywhere in the world, pretty much, because it's all cellular, it's all web-based. But obviously, we want to here connecting to the whole ecosystem of the police department.
Thank you so much for that information, and congratulations on the badge being changed, 175 years.
175 years.
So I think it's time, and this is going to indicate with the community that times have changed and the response and protecting and serving our community is definitely changing, but evolving with the time, so congratulations on that. We hope to continue to see you and get more information at the next meeting.
Definitely.
We are limited to a few minutes, so if any of our stakeholders have any information, please let us know at this point in time. Be very brief as we are trying to conclude with the meeting. Any stakeholders that would like to share or comment?
Hi, so Jessica Weiss with SCAN. I just wanted to remind everybody that SCAN does have adult, male and female, and adolescent male substance abuse inpatients beds available. And we also have numerous drug prevention, outpatient treatment, and recovery support programs that are also available. So for any information, please call us at 724-3175.
Thank you so much. Anybody else? Any other information? Alrighty, we're gonna go ahead and call this meeting to order at 12:58. There is no first or second that is required. Thank you so much. We'll see you next